Hospitals across the state activate their surge plans to help handle the increase in coronavirus patients. VA Secretary Robert Wilkie says they have beds ready to go. The VA in Tucson getting ready now to take in non-veterans, while in Phoenix, air-conditioned tents have been set up outside the VA to treat low-risk non-COVID patients. But despite the expanded coverage, Team 12's Erica Stapleton found that some veterans are still frustrated with the treatment that they're getting during the pandemic. Erica?
I talked with one veteran who says he was swabbed for COVID-19 last Monday after having some symptoms like chills and body aches. He says he called the VA for 4 straight days before finally hearing back and was told his sample was never tested. Before John Lama became a Department of Labor investigator, he spent 4 years as a firefighter with the Marines, but he never expected to get burned by the VA.
I'm thinking, come on, guys, this is basic.
After John was swabbed for COVID-19 through the VA, he says he waited for 4 days before finally getting this message from a nurse.
The information that I see in your record is that it's canceled. The test from June 22nd is canceled related to no specimen being found.
At the time, the sample never made it for testing.
I was a little bit in disbelief, number one, but also just shocked that they were so casual about it, just like, oh yeah, oops.
Meanwhile, John is waiting on results. He has an autoimmune condition and just wants some clarity on his health. And he's not the only one concerned. A letter from lawmakers sent to VA Secretary Robert Wilkie Monday asks him to explain why in a pandemic, some veterans are having delays or being denied authorizations for treatments outside the VA, an issue that shouldn't happen under the Mission Act.
A lot of the private sector is shut down. There is nothing for the veteran to go to.
Secretary Wilkie adds that Phoenix VA has come a long way from where it was a few years ago. He says the latest approval rating is 86%, the highest it's ever been, but also acknowledges there's room for error, especially when we asked him about John's missing test.
We have 9.5 million veterans. We've tested hundreds of thousands. Sadly, once in a while, something is going to get lost.
A VA spokesperson told 12 News that only part of John's sample was lost and they were able to send the other part for testing. Monday morning, John learned that test came back positive. John just thinks something so serious and so sensitive should have been handled with more care.
Mistakes happen, but I guess complete lack of empathy and awareness and, not taking responsibility, I think that's a concern.
The Phoenix VA says since March, they've only had 2 instances where additional testing was required. We're in Phoenix. Erica Stapleton, 12 News.
Okay, Erica, thanks.